create doses, and the disease. Similia, similibus curandum. Homeopathic medicines are actually the medicines which generate the symptom. For example, aconitum. Aconitum has gotten aconitum given in the crude form in a healthy man. What all symptoms produced by that, those produced symptoms must be taken as the symptoms of aconitum. Anybody having the same symptoms, this is given in the dilute form. Modern system, modern medicine, modern chemistry cannot understand anything about homeopathy. The homeopathy where it originated in Germany, even there it was been discarded because of they could not realize what it is. They could not make out any medicine in it. For example, dilution. Dilution technique you may be knowing. The crudest form, that is mother tincture, is the weakest according to homeopathy. 10 ml of this crude extract, from that 1 ml is added to 9 ml of rectified spirit. 1/10 will be the concentration of that crude extract. That is 1x. From 1x, 1 ml is being taken, 9 ml rectified spirit is taken, and it is triturated once. Trituration means 360 degrees it is being rotated very slowly. That is 2x. From 2x, 3x is prepared. 1 ml of 2x added to 9 ml of rectified spirit, it will become 3x. This way you can understand how dilution is going on each time. Can you imagine the medicine concentration in 1 million potency? But the power of medicine can be shown without any difficulty. For example, sulfur. A person who is having skin disease, sulfur 1 million potency is given. Within 4 to 5 hours, there will be aggravation. Same amount of rectified spirit is given, there will no action will be there. Why? Modern chemistry cannot answer, but the results are there. This is acting on the basis of prabhava according to Ayurveda. That is not based on the substance present, but it is the prabhava of the medicine. That is why this is the only country where homeopathy research is going on. We have got a department of homeopathy and alternative medicines. We respect that, and we have contributed many medicines in homeopathy. This is India's nature. So after 30x, even the most sophisticated atomic scanner cannot detect the element in it. Can you dismiss that it is not present? The science cannot be accepted. That is what Germany did. So we are losing a potent and effective methodology by which human beings can be treated. So open-mindedness must be there, and we should not insist that this is the only way by which truth can be elucidated. No, this is the best example. Any medicine above 30 potency, that can never be detected in that medicine. Only few drops are given. Dose is also very much limited, but it acts. There are ever so many trained, qualified homeopaths are there. They are succeeding in many chronic disorders. Recently one article came, it is only placebo. Any medicine is a placebo then. You can understand how many medicines are being introduced into the market with great hue and cry. What happens within 1 year, it is being withdrawn. So the methodology to assess the efficacy of medicine and introduction of medicine for human practice, everything is erroneous. It is to be perfected further. It is not a perfect science at all. I am not partial to anything. I am very open-minded. I am not claiming a vainglory of Ayurveda. We were having so many things in the past. No, what we are having at hand now, and we can show that this is a science which is having superiority to many medicine systems of healing at present. We can show that. And the diagnostics tool we use is pulse examination. This is what they cannot assess that. Pulse exam, rate, rhythm, volume and character. These are the only things which are assessed in modern system. It will come under cardiovascular system. But it is it has got twin functions. It is in Ayurveda, it will come under nervous system and cardiovascular system. According to Ayurveda, there are two hearts. Hridayam dividam proktam, urastidam cha shirastidam. We have got two hearts. One it is in the thorax, and other is in the head. The thoracic heart is being considered as Heya Hridayam. The cerebral heart is Upadaya Hridayam. The texts are written at least 15,000 years back. How the accuracy is? Two types of Hridayams are there. One is Urastidam and other is Sirastidam. What is the answer for them? Can they dismiss that it is baseless? Heart muscles, everything is under control of the nervous system. The intrauterine life, the first life symptoms originate through nervous system. So, nerve transmission, neurological control, everything is well known to Ayurveda. From the Upadaya Hridayam, we find out the temperament, predispositions, attitudes, etc. of the patient. The Heya Hridayam, the present achievements, interactions with nature, his worries, and so many other emotional factors, everything we can judge from this Heya Hridayam. This is the most powerful diagnostic tool ever known, no doubt about it. And the things which can probe into, no modern system, even scanning, whatever it be, genetic studies, nothing can bring about. Such a powerful tool is with us. How many persons are practicing, that is debatable, that is something different. Fortunately, by the grace of God, we have preserved it. Our heritage has we have got well preserved practice, and it is well protected, and it is being taught. There is nothing missing in it. Anybody can teach who is having real interest in the science. So, we have to change the attitude first. Modern medicine has got everything. It is the final word of human health is absurdity. It is not. It is far, far inferior to many systems available at present. These things, some people at least, they are subjected to Ayurvedic treatment. You could have experienced the greatness of Ayurveda. So, we can show them. This is not boasting. We can show the efficacy of Ayurveda in all fields, not only this muscle pain or some simple diseases, in grave chronic disease also we can show that this is superior. Don't take it, don't believe that Ayurveda is a alternative medicine. This is the mother of all healing systems in the world. What all inventions now at present available, all these things Ayurveda can accept. It has got such an approach to life. It's a science of life. All aspects of life will will be the consideration of Ayurveda, not one part or other. It is holistic. Everything is being analyzed, studied by our rishis. This is great. That greatness can be shown in all aspects of human life. So, any doubt, we will start from there. Because from there we will start. Any doubt? So far you have heard. My derivation is Ayurvedam is superior to all the systems available now.
Okay, I'll ask one very simple layman.
Yes, please.
In our country we have so many practitioners practicing all kind of medical systems. Yet I think if you actually look at the percentage of population that is not healthy, is actually very high compared to many other advanced countries. Okay, so I mean, where is this irony? I mean, how come this irony is there?
There are so many, the way you approach to that. For example, Western countries, they are suffering from actually overnutrition. Most of the maladies of the West are because of overnutrition. Here, it is because of the malnutrition. But if take individuals from the West and in India, the quality of human personality is much better. Their resilience, their capacity to survive, and their attitude to life is far superior to this modern world or the Western people. This is because of our great heritage. As consumer culture, we may be lacking many things. We don't consider health as the body weight or the girth of the upper arm. So many parameters are there, but their capacity to do work is far superior even now. The attitude to life. For example, the war against the American war in Nigeria and Vietnam, most of the weapons were seized from American soldiers. When they see a mountain to pass next day, they feel it difficult and they take drugs and die. This is known to all. Most of the weapons are there, they need not fight, they will be sleeping and dying. Heavy dose of soporifics they take and die. To face a critical situation, an American and Indian will be definitely succeeding. He will be definitely superior because the cultural or inherited capacity. So, in certain body weight ways or some other parameters we may be lacking, but as human beings we are definitely superior. And intellectual also, I am not boasting, intellectual level also we are not second to anybody in the world. I can cite hundreds of examples. Our scientific intelligentsia, everything is definitely superior. Nothing to boast, this is a fact.
This problem of each patient is individual,
Yes.
and therefore the treatment has to be customized,
Yes.
and therefore the validation of a particular formulation becomes almost impossible.
Yes.
So then, according to the way we define science, repeatability is a very important part of the...
Dr. Chatterjee has gone. That concept is gone now. Repeatability was once upon a time the greatness of modern science. Now nothing can be repeated. Now this axiomatic or universal approach to the science also is different now. This hypothesis or this theory will be valid till another comes. How many times it has been revalidated?
But
the mechanical theory is completely gone. Einstein came. That is exploded. Each time it is being exploded.
no, that is true. But the problem is that if we do not have repeatability, then how do you teach? The problem
It is repeatability means the basic principles are repeatable. That is why I am coming to that point. We have got a universal concept about matter and life. So anything is a medicine according to Ayurveda. Nothing can be non-medicinal. Any substance in the universe is a medicine because this body is Panchapaudik, the substance is also Panchapaudik, the health or aspirations or expressions of this material body is same. But how it is to be used? It is improperly used, it will become a toxin or visham. Properly used, visham also will become medicine. It depends on the way of using a substance. Ayurveda gives wide margins or border instructions